Kim, a first responder who, due to a work related injury and malpractice, is now a disabled chronic pain patient. She is here to tell her story and advocate for herself and other chronic pain patients. And with that, I'd like to welcome Kim.
Thank you, doctor, so much. I appreciate this. This is a huge opportunity.
Of
So I
course,
can bring awareness.
it's our pleasure. Why don't you go ahead and tell us your story? What happened and what led you to the chronic state of pain that you're in right now?
Okay, like you stated, I was injured on the job. I used to work for the fire service. So I was injured on the job. My first back surgery was in 2011, and that was a discectomy. So I had went down on shift. I couldn't get back up and ended up in surgery, and that was when my field career ended. Uh, the spine specialist told me that it would be a few years, that my back was so diseased that I would need to have a fusion. So I put it off as long as I could until I literally could not walk. So I went into surgery 9 uh, September of 2018. Um, and I was going in for a 345 S1 or 45 L45 S1 fusion with cadaver bones and cages. Initially, they wanted to go in the front, and then they ended up going posterior. Um, upon After having the surgery, I was wheeled back to the patient room. Now, keep in mind, I don't remember any of this. Um, my best friend, who is an RN, BSN, house supervisor, and has, worked in the medical field for quite some time, witnessed me. She said I flew out of bed. I don't know who flies out of bed after a multi level fusion. And she said I flew out of bed screaming, crying, in full pain delirium. She said I was completely out of it, screaming in pain, and they were trying to feed me gabapentin and Tylenol and would not medicate me properly. Per pain protocol, I should have had a pump. Had nothing of that nature. Um, all I What I remember over there is being so ill. I was projectile vomiting, full on diarrhea, couldn't eat, couldn't drink. Um, I had a JP drain that was filled up, overflowed with blood because they would not empty it twice. No DVT cuffs to prevent blood clots. They also had a resident come in to check my back to to check the scarring and everything like that. And I wasn't moving fast enough because I was grabbing on the part. I mean, mind you, my pain was a 10 plus plus plus. I've never experienced pain at this level. And he pushed me, literally pushed me over. So at this time, all this was happening, and the negligence was so severe and harmful. I told them, I said, I'm going to get out of here and go somewhere I can get help. And they said, well, you're going to have to discharge AMA. And I said, no, I won't. I said, if you do not discharge me normally and regularly to get out of here so I can get regular treatment from your negligence, I will have a lawyer down
So
here
let's
within
talk.
30 minutes. And I said that, and they let me go.
So let's talk about the pain
But
management and your
that's when
surgery. I
everything
wrote down that you had
started.
mentioned 2018. That's when a lot of the opioid phobia was really at peak hysteria. But what was it about your surgery, your presentation that caused alarm that made them not want to treat you adequately in terms of pain? Or was it simply they just defaulted to a decision not to treat you properly?
I think it's a combination of things. Being that I've worked all my life and had private insurance, I would have never been treated like that. The minute I was put on Access, Medicare, Medicaid, government insurance, I was treated and judged completely different, and had didn't have the same pick of the doctors. Wasn't my initial spinal surgeon that I wanted, that I had lost. Um, I think I was basically judged because I have no dings on my record, clean record. I've never had. There was no reasoning behind that whatsoever, except for the fact that they were just that negligent. I I, I I didn't think I could ever see anything that bad.
Did you have an opportunity to speak with the surgeon or the chief anesthesiologist and express your concerns?
I did. I also went to the medical board. The surgeon, actually, when I went to another ER upon discharge, and that's where the ER doctor found me anemic, malnourished. I was still projectile vomiting, lost 15 pounds in a week, and had a large seroma on my spine. And he said that I needed a blood patch. He called Dr. Chutkin, and Dr. Chutkin's office put me on the phone and started yelling, "You don't need this. What are you doing over there? Blah, 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 blah." I mean, they just didn't want anything to do with me. Like, basically, the doctor that saw me the second time was horrified from the care and the neglect. And he told them what was going on with me and what was needed. And I was abandoned, neglected, just completely dismissed and ignored. So they not only did they not do evidence-based practices of a blood patch, which I often think that's why I was diagnosed with a rare case of IIH. I tell you what, with without proper pain
Ischemic attack, yeah.
protocol, not only was I further injured, I had a brand new neurological diagnosis that I didn't even fit the bill for. Even the neurologist had said that. But I also had a TIA, which is a transient, you know what it is, ischemic attack, which is a mini stroke. And this is all from not proper medicating me. And the complications that ensued from that were devastating. They destroyed my life, literally destroyed my life. I went from having that to a few diagnoses to disabled, now to having a top neurological rare complex case that no one will take. I've been, since I've been on Medicare and Medicaid, I have been left untreated. Um, I've been through multiple pain doctors because they all want injections. I've already had all the injections you can have,
Mm-hmm.
all the RFAs you can have. I'm not allowed to have NSAIDs. I'm not allowed to have steroids. I'm not allowed to have Bactrim. These are all due to vision loss. I have visual disturbances. Right now, I see you, but I see you blurry. And I can't see really well unless it's up close. And this has been going on since 2018, all the way to the point that I've declined to be on palliative care. My ADLs, I'm waiting for Altex. My quality of life has gone to hell. Um, oh yes. Uh, I've worked with doctors. We used to have an excellent healthcare system at one
Now,
point. I
flash forward to
remember
the
that.
present,
But
2023. Have you taken any
everybody wants to
action,
do
either
billable
administrative or
services,
legally,
especially when
to
you're on Medicare and
rectify
Medicaid.
what had happened?
And the fraud
And
is
is the
so
change
high
in
that
perception of
I have
pain
I've
management
had to
helping your
report
cause in any
Medicare
way?
Medicaid fraud. I've had
So,
to report. I've went
what's
to the
interesting
medical
about your
board,
experiences is that there's
DHS.
certain.
I've won numerous. I won a state investigation. They
Go
sold
ahead.
my class 3 meds. Then they were writing prescriptions under my name for the prescriptions to take themselves. The insurance company caught it. Then it was on my on. I had to clean up my reputation because what they had done in that sniff. And I don't think I was able to. I don't know if I got to send you a copy of that, but it was a priority level 1 for harmful and safety negligence, and all the allegations that I sent to them were founded. I was vindicated on it. So people,
Mm-hmm.
oh, what I what's happening today is barbaric. The suffering, the death that's happening, and it's so it's like it's so huge, and yet it keeps getting worse and worse and worse, and you see so much suffering and so much pain and so much death where it's would not happen if the people would
Well,
control the pain medications correctly and watch for the ones
let's
that there's
explore that.
people that have taken opiates on and
So
off,
let's explore
narcotics
the
on and off
concept of
all
a
their lives from
procedure and whether
surgeries,
it's
and
good
they've
for you
never
or
been
not good for you.
addicted. And that's me.
Suppose
I've
I, as a
detoxed
physician,
numerous
present a
times
clinical study to you and
just by
say, well, look
myself
at this study.
within a
It
week
shows that procedures
because
are more
you go to a
effective
pain specialist
than
and they say,
taking
no, we'll
opioids in
only do it
general.
once
As a
because you haven't
patient,
got an injection
how do you
or
counter
a
that,
spinal cord
and how do you
stimulator.
navigate the
Or,
conversation
and
to
I'm
ensure
not
that the
even
care you need is specified for you?
medically cleared to get a spinal cord stimulator, nor to get any more of those services that they want. So I've done so much research and investigation. You can't find one place that has med management that they will control for chronically ill people in chronic pain. They all require some form of non invasive
No, it's
procedure,
okay. Take your time.
whether it's going to help you or not, whether it's good for you or not. It's all about money. Well, I am judged constantly because people
It's okay.
can't grasp invisible diseases. They can't grasp that someone can look normal but have their internal body completely breaking down. Like my autonomic system is firing haywire. Everything's breaking down internally, which is making me really sick. Um, what I do when I advocate for people, for myself and for people, I always say, excuse me, I get dry mouth. I take so many meds. Sorry about that. But we were saying, so I'll go in and I'll expect these doctors to. They all look at you like, now it used to never be a question. And with someone with my history and they have all my records, they know that I'm in some serious pain because it's my whole spine. I have cervical, thoracic, and lumbar. And then they see my history, they see the pain, but yet they just look at you like
Mm-hmm.
you're a drug seeker. I think it doesn't even matter who you are, you're a drug seeker to them. Um, unless you're going to get all these preventative measures. All I can say is that I go in and say, you have not lived a day in my body, nor do you understand. And I ask them to be open minded and I asked them to look at my records, and I asked them, do you think you could handle this? Do you think you could handle this? Now, most people, not even most MDs, which I was told, understand the complexity of my neurological case. Well, okay, if they don't understand it, then why don't they just, they need to be honest and truthful and straight up and say, look, either we can't handle you or it's too much for us or whatnot, so I can go to someone else. The last pain specialist I went to, they wasted 3 months of my time to have an office staff member get on
So
there and say,
let
first of
me
all, we're
ask you a
not going
few
to give you the
questions,
meds you're
and
on. Second of all, you have to do
I'm
injections.
sorry to cut
I
you
said,
off.
of which
I want to
you
ask a couple
known
of
and had
questions that I
my
think
records for 3 months that I am not cleared to do any of these and that I require med management only. Well, we can't take you. I said, so
there's a
after
little bit of
waiting,
delay, so we just
making
have
me
to
wait for three
be
months to
mindful
get
of that,
in with
and I'll
you,
cut that
when it's already
statement out.
hard to find
Um,
one pain
I really
specialist
like
after
the way
that'll
you
take you.
or labeled a
They
certain
did
way.
that over the phone.
Um,
So when I get complaints like
that
that,
leads is
I
prioritizing the use of
I do
opioids.
complaints,
Patients are often then
grievances,
stigmatized or judged.
AZDHS. The amount of complaints and grievances and how hard I've worked to report these negligent, dismissive entities is just mind-boggling. But there are so many of them. I've witnessed what they've done to patients. I've been subjected to it and witnessed it myself. So all I can do is go in there and professionally speak. Hmm? All I can do is professionally. Okay.
Handled that question I asked because I think for many chronic pain patients that are in your situation where the treatment is
I believe I was blessed with that, honestly. Um, I had a lot of time when my life was destroyed. All, matter of time. I lost everything, my housing, my car, everything that you don't ever think it can happen to you. I had some time when I was in that skilled nursing and I was writing a journal and I was doing times and dates and every occurrence that was happening. And I knew that I had to do some research and I knew what was happening was so bad. And we haven't even gotten to the details of that. These atrocities that were happening, I could not sit by the wayside and watch it. I was not going to be one of them. Uh, so what I did is I started researching and I started looking up everything. And I've been to AZDHS, Ombudsman, FTC, to the senators, to the I've had and then I got on Twitter and started advocating and started finding doctors and people of like mind trying to help and advocate. And I found all these resources and the complaint lines and this and that and what you can do for this and that. And the public is not educated. I already know I already knew the patient laws and the rights and all that stuff, right? And I also knew the medical side of it. But I just it fueled me as sick as it fueled me, and I thought till my last breath I'm going to advocate because what I had witnessed no one could have imagined. I couldn't even have imagined. And it just fueled me to do whatever I could to get get this out. I started a petition.
Hmm.
Uh, I started a medical malpractice group. I started, with a friend, stuff that I could do with my physical limitations since I'm homebound all the time. That's not a way to live. I mean, as chronic pain patients know, you don't get nothing's consistent anymore. You don't get consistent pain meds either. So you go 2 or 3 days, you know what I mean, or a week without them. Then you have to wait if it's in stock. I mean, it's a nightmare. And I knew something
Understood.
had to be changed,
No,
and
no,
I
no.
wanted to be.
So
I wanted to
let's
just do whatever I
parse down
possibly.
two
I knew it
things.
was
I
just
think
one voice,
you bring
but
up
I
some
knew if I could
really
get
really good
like-minded
points.
people,
So
that
my
we
first
could
question
change
is:
things.
have
Because
you found physicians that will take the time to
it's
understand
bigger than me.
you
It's
and
bigger.
stopping,
It's just
even though you're trying to
mind-boggling how
find
big it
a
is
physician who
and how bad it
understands
was.
you? I think it's quite
But what I
ironic
try
that
to educate
patients like
people
yourself
is you
that are
can't go in
empowered
there
and
throwing a
looking to
tantrum.
create a health
You have to
experience
go
that
in
works.
there
Second question
and
is,
be
how do you
firm
overcome
and factual and direct and calm. And this is how you advocate. And if someone does this and they're not fitting, you move on to the next one. I don't, if they think you're doctor shopping, so be it. I said, I'm not going to go through another treatment like I did with that doctor. You know what I mean? I would never wish that on anybody. So the world's not educated enough. A lot of people don't understand. They judge prematurely. They look at someone, oh, you look fine. Oh, you can do this and that. They have no idea the suffering that people go through on a daily basis, nor do they care.
let me
Well, I do. So,
for them are often then tagged with these red flags like doctor shopping. So those inaccurate red flags.
well, you're going to have people attack you at every corner. You have to do what's right for you. After you experience something that's so bad that someone does, you're not going to allow that to, I mean, I'm not going to allow that to happen to me again. I have found some of the most amazing providers. Now, few and far between nowadays, but there are some really good ones out there. My PCP, wonderful. Um, I have a couple of specialists that are good, but now I'm in the process of getting all new ones that are really good. The problem I find um, is neurosurgery and neurology. Now, that's who I keep running into. Is
There's something
they'll
unique about
promise you
those
the
types of
world.
physicians
They say
that
we're going to do a
instantly clicks
pre-trial
for
shunt.
you.
We're
And the
going to
second
try all
question
this
is,
testing.
when you
We're going to
mentioned
do this,
about
this, and that. And they do
portraying as Dr.
Botox. They do billable services. Those trigger point injections, and then maybe a couple MRIs and scans, and that's it. So a year later, you're looking back. What's happened? Nothing's done. And there's a portal. That's where you keep communication up. I keep my symptoms, my hospitalizations, everything up, all my records, because a lot of them are falsified. I have been tagged and retaliated against. like no other because I'm considered a troublemaker, because I won't stop, because they're not going to run all over me, and they're not going to run all over people. Now, you have to control your emotions. I learned how to do that. I learned how to, I read a lot of positive psychology. I did a lot of that, training, mental. And all I can say is I've tried and tried and tried and tried. Well, there's no other option. It's, do I lay down and die?
Mhm.
Because that's where I'm headed anyway. Or do I fight until I find someone that's going to take care of me? And I tell people there's no other choice. You either die or you fight. And so, yeah, I
Yeah.
have been red flagged. I believe I've been flagged big time as a troublemaker. I've been retaliated against big time, but I still do it. And then I still win investigations. So I do what's
Patients didn't
right,
have to
but
file complaints or go to boards and other
it's
forms of
just
recourse.
when I
Where
start to
did
think of
you
it, doctor,
learn how to take these administrative
the
actions?
amount of paperwork, if I had to show you, it just blows my mind. And you tell someone one thing, a lot of people don't go in and read their medical notes. I had a neurologist ask me who my neurologist was. It's on the portal, caught on screenshot, the neurologist. I think what's happened is we've been inundated and saturated with a bunch of incompetent, greedy, unethical people that are
Yeah.
making the good people look bad. Does that make sense? And not everybody is bad, but you have to dig to find the good ones. And some people just automatically believe they're doctors. And when they do falsely or blindly follow that, sometimes they're lucky, sometimes they're not.
Yeah.
Uh, now I don't take it for, I ask questions, a lot of questions, and I make sure they're the right fit for me.
Can you give some examples of victories or setbacks, even though that's probably not the right way to phrase it, but in advocacy, you're always going to have moments where days are good, when days are bad, and how you would respond to each. Hmm.
Oh yeah, I have. Yeah, I'm human. I have bad days once in a while, but how do I respond? So usually, because I'm so used to it, I'm like, okay, here's another one.
Hmm.
I'm actually shocked when something goes my way. It just kind of surprises me. I I actually expect it to happen, but when it doesn't, it means that all this hard work I've been doing is paying off. But for every little blessing or award that you get, you need to keep pushing because it's getting out there some way. Somebody's listening, someone's paying attention
Right.
somewhere, even though you don't think it is. Because at one time,
So a
I
good
felt
event
like
happens,
the
how
whole
would you
world was
respond?
against me, which
The
they pretty
adverse
much
event
were.
happens, how do you
But I had
respond?
to face reality and say that's, it is what it is, and not allow it to consume me. Because you can have a bad day and cry and let it all out, but I don't stay in the moment. And there's something that fires me up, that makes me want to fight even harder when I see the lack of compassion, empathy, and caring. It just puts fuel behind me to work even harder and find like minded people
Yeah.
to work with and do things to make a difference. because
In the
the
time that
way
we
it's
have,
going, it can't continue. It can't. It's, I mean, the amount, I'm astounded at the amount of deaths, wrongful deaths,
yeah,
uh,
in the
that
time
could
that we
have
have
been
remaining, can you give some advice for those
prevented.
who are listening?
Hmm.
And can you give
Or
some, oh,
complications
that's fine.
from
In the
surgery.
remaining time that we
There's
have,
articles out
can
there
you
that it
give some
shows it
advice to
from
other chronic pain
improper
patients
pain
who are
protocol,
interested in becoming
the
advocates
severe
like yourself?
complications that it can occur from that. Um, well, I'm living proof. I was not only injured, I was disabled, and I have multiple diagnoses because of this. I mean, who knows what happened to the. I'm sorry, can you say that again? I didn't hear that one,
Yeah.
doctor. Well, yes. Well, the advice I would give is try to find like minded people. Um, and if you want to advocate, start researching. This is what I find is even through me with my, sometimes I can't research at all. I can't see crap, you know what I mean? But I struggle through seeing blurry and visual disturbances all the time. Um, there's no excuse for people not to research. If they want to do something bad enough, they're going to do it. A lot of people want you to do the research for them and hand it
Yeah.
to them. So what I tell them to do is
Yeah.
research,
Becoming an advocate
find
and
like-minded
having their
people,
voices heard.
doctors, nurses, people in the medical field that they can give them some information, some resources.
In the remaining
I'm
time that we
talking
have,
to a pain, a nurse expert advocate right now, and she joined my group, the malpractice group, and she's wanting me to work with her. And so we were discussing this. I got her on Twitter. I sent her I advertise your podcast. It's getting that information out, letting people know that there are amazing doctors out there. There are amazing people out there that know what's going on and are willing to help. That they can't just throw their hands up and say, I hate everybody, because that's not true. So I just try to tell them, you're going to have days you're going to be disappointed a lot,
in the
but you know
time that we
what?
have
You get back
remaining,
up and you do it again.
can you give?
There's no other choice. Um, if you want to get things fixed,
Yeah.
then you start advocating and get like minded people and educate yourself. Take extra courses if you can. Um, Stuff like that. That's what I would recommend to them. I try to teach them how to advocate, be professional, non emotional, not going in there all, you know, be factual, to take their documentation in every time, to keep a medical journal, to write notes. So I do my best in trying to educate with that.